integration of DHA and NABID in your patient management software in dental clinics. So there are many questions that we receive every day about what is NABID. Maybe my program is compliant, maybe it's not compliant. People don't know, don't know what to do, don't know what will happen if they are not compliant. And I am going to try and go over all this discussion about what is NABID first. So NABID first is something very simple. It is a program which is online, and all what you do on a patient will be stored online by this NABID program, and you will get access to check what is the history of your patients, the patients you are meeting. So this is starting with hospitals and big hospitals, and it's hardly starting with dental clinics, because there was no exclusive dental clinic software. So today, I think that we have one of the very first software with AccuDent working on NABID. So the first thing is NABID mandatory? The answer is absolutely yes. NABID is mandatory to use, and the deadline is June 2023. After that, DHA will go in the dental clinics and will check if you are using a software which is NABID compliant. To use a software which is NABID compliant, and maybe one which is not NABID compliant, it takes several months. To make the settings, to prepare everything, it will take at least 2 months. So I would advise you warmly to start implementing your software as soon as possible, because after that, it will be too late. There was a deadline before, it was the end of 2029, and they have been postponing, not because of the dentist, but because they were not able to make the program in a good way on their side. So we are a manufacturer, and paramedical software, DMCC, and as a medical software manufacturer, we can work directly to implement that in a fast way. So doing that, we've been able to make the first cleaning, which is Alabama Dental Center, compliant with NABID. So I will show you how to access to NABID, to access to the data you've been sending to NABID, and I will show you how it's working. We don't only have specification to do with NABID, we have specifications to do with DHA also. And including in DHA, we have several things to do, more than before. And we have the statistics to do. I will show you how to make the statistics in few clicks in a very easy way. So to sum up, we will go into details of all these things. And NABID is an online software which is NABID compliant. And but it's not enough to be NABID compliant. Your clinic must be compliant if you use NABID. So there are 2 steps. One is using a software. The second is being NABID compliant. And of course, we take care of that because it's long and complicated. So let's go into the program. And I am going to show you in the program where are the points which are recommended by NABID, and where are the other which are demanded by DHA. So I am in the login page. I sign, it's a demo account. All of you can have an access to the demo account, and you will be able to do the same thing as I do. Okay, let me change that. Okay, I sign in. And I am in the software. In the software, I come on the diary. And this is the first step. When you come on the software, you come on the diary. So there is nothing special for NABID. you have in this clinic two practitioners, Arshad and Ursula. We are going to stay on Arshad, and we are going to just see when we open a file, what's happening. So I open the file of Anna Joseph. I am on a file, and on a file, I see several buttons here. And one of the buttons that you should not have if you are not compliant is patient arrived. This means that you need to tell to NABID that your patient is arrived if you want what you do to be connected with NABID. So you click on patients arrived. I will not do it because I don't want to add things to that, but I am in the demo, so I can show. So patients arrived. Are you sure you want to update patients arrived? Do you want to be linked to NABID? This is what you need to understand. So when the patient is arrived, you are going to make a certain number of things. You are going to add procedures. You are going to add prescription. You are going to add many things. You are going to fill the medical questionnaire and all that. And at the end, when the patient is going to leave, you will click on discharge. Clicking on discharge will send all the information that you've been adding to your patients to NABID. This is the way it is working. So I click on discharge, and means that we will discharge the patient, and the patient is discharged. So if you miss the discharge because you have several patients together, you don't know who's been paying, who did not pay, and all that thing, so you don't want to lose anything, so you forget to click on patient discharge, and we've been doing in our program an automatic discharge, which will come automatically at midnight the day after. So even if you forget to do it, there is the security that the patient will be discharged after being arrived. Okay, that's very important because this is a new way to work. You need to show that your patient arrived before doing anything. So now you have a certain number of fields that you need to fill for NABID. Let me give you one thing more here. If you did not click on patients arrived and you want to add a procedure is like this. I click on endo. I want to make a root canal on an anterior tooth. I click here and I am making a root canal on an anterior tooth. So the root canal is treated here, and you see here, you have a root canal on the anterior, and you have the price of this. You can make a discount, so I remove, let's say 10%, okay? I save the selected line, and as long as the patient is not arrived, you will see here at the bottom, send to NABID. So this means that if you forgot to click on patients arrived, if you are not in a session like this, you can send to NABID even if it is not done. Patient procedure successfully sent. And now you are going to send all that automatically, sending to NABID. No need to go back to patients arrived, patient discharged. Okay? So this is to make it easy for you to send. If you don't send, NABID will not come to you and say, hey, you did not send anything. It's not a problem. You are compliant. You send what you want. On sending what you want, you have to know that all the payments are outside of NABID requirements. You are not sending anything based on the invoice and based on the payment. This is outside of that. Only the diagnosis and the procedure done and the questionnaire are linked to NABID, not the rest, and the patient's identity. So that's very important. It's not important only for NABID, it's important also for DHA. So what we do also, we present that. So I want to see the image of the patient. So I just click here. I have the patient image, and I have the patient image on my files. So I can do the same here. If I reload the diary and I click on my patients, who is Anna Joseph, on top of that, I will see the image coming. It's a little long. I will show you later. So now we have the image of the patient and we have the name. Most of the time, when we take an appointment for the first time, we ask for the name of the patient, first name, family name, okay? But what is mandatory to ask now, because you see there is a small star here, it is the date of birth. This is mandatory for NABID. So you need to teach to your assistant when a patient is coming like this, you say, because of the new regulation, I need to ask you for your birthday, okay? And if they don't want to give their birthday, you need just to make a fake birthday. This is what we do when a patient doesn't want to give their birth date. We put 01, 01, and 2000. And we know that this is a fake birthday. And when the patient will come, we will edit the birth date. So what I can tell you also is that to avoid all the mistakes on first name, family name, and on the document ID and all that, because there are big numbers here, we have a special thing to do, and it is to scan ID. So we are here, and we have an ID. We allow to have the camera, yes, allow, and I put the ID, and I switch the camera to the ID, and it's switching to the ID, let's say like this, and I take the front and I take the back, and automatically taking the front and the back, I will implement the name, the first name, the family name, and the not the email address, but the document ID. Be careful, the document ID must be this format. It is not 784 hash 1960 hash and the number. It is this format in the ID document, but in the statistics, it is a different format. So no need for you to bother your secretary doing the good format, the bad format, and all that. They are not applying the same rules inside the patient's file for NABID and in the statistics for DHA. Despite that, we've been making the program so that all this is automatic now, and you will not have to bother about what is the format of the document ID. Document ID can be Emirates ID, but also passport, a driving license, or a GCC ID. So whatever you select, in this case, it's an Emirate ID, you need to put the number in that, because this is mandatory to transfer in the statistics and in NABID also. So knowing that, you see that even on basic things, you have new things coming to your mind. So what is the state of residence? This is, again, something which is mandatory for the stats. So you need to click on where it is. So in this case, it's Dubai. What is the nationality? India. And what is the region? Asian, non-Arabic countries with all these different options. And this will be very useful for you because automatically it will come in the statistics without doing anything.
David, how are you?
Okay, what I have here in file number is the paper file that you have. Can you close this? Is the paper file that you have in on these patients. Okay, so all of us have some paper file because we cannot use only digital. So the full paperless means that we have no more paper. It's just a tendency. It's a trend. It's an idea, but it's not reality. We need some files, and here you will get the files. I will show you where we find the files number elsewhere. So we went to the state of residence, nationality, region, documents, ID number. We need, and this is mandatory for NABID, we need to link a patient to a practitioner. We cannot have a patient coming like this in a clinic with no practitioner. It must be linked to a practitioner. It is a mistake if it's not linked to a practitioner. So that's very important. When we select a patient, when we select the list of patients of one practitioner, it will come from this, the practitioner list of patient options. So for statistic search, we need something else. They are adding Emirati, non-Emirati, international, These are the visitors, okay? We've been adding, these are visitors because international can be non-Emirati. So we have non-Emirati, visitors, and resident. So this is a non-Emirati resident, and the address is this, the Palm Dubai. Okay. Okay. Now let's go to the next step, which is a very important step. Whatever you do with the insurance, you can have patients who are insured and they have an insurance, or they have no insurance and they are treated in the same way. And you have insurance network, and this is different, and I'm going to show you why. If you have no insurance, there is nothing special to fill because there is no insurance. If there is an insurance, you have to fill the effective date, the expiry date, the insurance name, and you have the list. You have maybe 25 different insurance here, okay? So we have, let's say, MedNet, and you have the insurance number. You need to fill the insurance number. If you don't fill the insurance number linked to an insurance, this will be an issue with NABID. NABID will ask you to be compliant with them, filling the insurance number, whatever, even if it's a fake number, you need to fill the insurance number. So what you have here on top, you have the name, you have the address, you have all these things. So you just click here. Patient is same as insured, because in some cases, the father is the insured and the patient is the kid, okay? So as long as in this case, Anna Joseph is at the same time the patient and the insured person, if I click on this, all this will be filled by default, including the date of birth. Okay, so now we need one more field, and all that is mandatory today. So it's not simple. Is the insured nationality? So not only we need the insured nationality, which is here, the nationality of the patient, but we need the nationality of the insured person. Okay, because in some cases the insured person, the father, doesn't get the same nationality as the kids, for example, or the wife. So after that, we have some kind of appointments reminders. So this is not
for NABID compliant software.
This is not linked to whatever it is with NABID or DHA. This is for reminding your patient to work with you in a good way. For example, you before an appointment, 1 day before, or 2 days before, or 1 week before, by SMS and by email or by WhatsApp, you will call back the patient automatically. Okay, WhatsApp is special because you need a WhatsApp business, and not all of you, they have WhatsApp business, but this will come more in the future. You have also one-time reminder, so you edit the reminder date. So reminder that, let's say, I have been placing implants in September, and I want the patient to come in November 16, and I will remind him to come to activate the implant. So I go implant activation reminder, and automatically the patient will receive in 2 months something to come back. I have also periodic reminder, which is used in orthodontics. It is used also in reminding people in cleaning and scaling. So starting from today, I've been making a scaling today. To date, I can stop the end date, or I can leave it open. Every 6 months, by email, this patient will receive a next cleaning reminder text by email. And we can do the same by SMS. And SMS, the text is shorter, and this text needs to be validated by the hosting server that we have in the Emirates. We have a server in the Emirates, and this is again mandatory, and we have to do it for NABID and for DHA. We need to have a local hosting. So all this you see are some kind of new things, and if you don't have all these things, you will need to find them. You will need to go and find where it is for sending the statistics and all that. So if all this is done, it will become very, very easy to manipulate all this data. So now I go to the patient's file, and this is the patient's file. On top here, you have the name, and you can select another name as you want. You have the age, which is coming from the previous page, and the age will come all the time because you remember the date of birth is mandatory. You have something which is useful in the dental clinic. It's about the cast. So the casts are in the clinic somewhere on a box or on a shelf. The casts have been given to the patient. They have been scanned or they have been deleted. So you select what you've been doing with the last prosthetic casts. And very easily, you will know where it is. The insurance is MedNet. You cannot change. It's coming from the previous page. And the paper file number is number 9. So you see, at a glance, you see a lot of things to work with your patients. We've been going on the patient's card, you remember. Now we go to the chart. On the chart, we have current, initial, and treatment plan. So if we are in initial, initial is referring to the same thing as the OPG. If you don't see the OPG enough, you click on that and you put it in full screen like this. You see we have implants here, we have crowns, we have missing tooth replaced by a bridge. So when we go here, we have the bridge, we have the implants, we have the missing tooth, we have all the same that we have in the OPG. This is done in the chart, what we call the initial chart. Then we go to treatment plan, and we are going to edit a treatment plan. In this case, we have been editing a full treatment plan. So I go on my treatment plan. So how do I edit this? Let's see, I'm going to put an implant here. So I go to implant. I select an implant. I put an implant in 27. Wow. This is very simple. On 27, I have been placing an implant placement. This is the price. I double click and I can change the price. I can say it's for 4,000, for example, okay? I save the change and it comes like this. If the patient is not insured by MedNet, but if the clinic is in a network of MedNet, we will set up the price for MedNet network, and automatically, instead of getting 4,000, let's say, as a MedNet network, it will be the price of the implant placement by MedNet, probably something like 1,800 instead of 4,000. And this is the price that we are going to apply to this client, but we don't need to make it. It will be done automatically because we have the MedNet link to the network. So doing all this, I want to edit, let's say, a treatment plan. But before, I'm going to show you something else, and this is linked to NABIDH. It is the semiology. What is the semiology? The semiology, when you go in treatment plan, for example, the semiology is here. I have a mesio-occlusal dental caries on the dentine. So here, I have that. Here, I have that. I have here something like dental caries penetrant into pulp on one tooth. We can say we have that here. All these now, what you see are diagnosis, diagnosis, diagnosis. And the implant is a procedure. I have something else. If I do an alginate impression on the upper, okay, it will come as a work. You see, a work. I'm not going to charge for an impression. I'm going to charge for the crown that I will do. So it is a work. But the crown is a procedure. And these dental caries are diagnosis. So I am going to select these files, these procedures, and I'm going to edit a quotation, a treatment plan. So I go to form, I select a quotation, and I can edit a quotation. You will see the quotation is coming. You have the logo, you have the links of the dental clinic, and you have here the treatment plan with the procedure. So we can also edit the diagnosis if we want. So this is what we can print, but as long as we don't want to print all the time, we don't like paper, okay? So we are going to do it in a different way. We are going to go to signed documents. On a signed document, I go now to quotation sign, and I'm going to show you how we do to sign the quotation with the patient. So you see that we have the automatic signature of Dr. Philip here, and you have the patient signature here. So we do a digital signature. Most of the time, I am on my computer here. We do the signature on a tablet. You can even do it on your telephone. So we ask the patient to sign. The patient is going to sign here, and we save the signature. We save it. And now we have several options. We can directly save in history, okay? Or we save and we print. So we give a printed copy to the patient, but once again, we use paper and we don't want to use paper. Or we can save in our history and send to the patient by email. You have nothing to do but this. You click, and email was not found because it's a fake email, and you send, and it will be sent by email. So this is the new generation. This is the way you're going to work online directly with new things, thanks to what they want in NABIDH and DHA. So this is the new trend of what we are going to do. I go forward now. We're making a treatment plan, and we go to current. In current, we will get what we had at the initial start. So I'm going to delete all that, and we are going to work together on what we do. So at the beginning, most of the time, we need to take OPG. So we take one OPG, and we charge for the OPG. Okay. So this is the OPG. And the OPG will be stored in images. I will show you that a little later. So now what I want to do, I can make a periapical X-ray on this tooth because I suspect that there is something wrong here, okay? And doing that, I have the periapical, I double click, and this is linked to NABIDH. You have two comments, not only one. They ask for two comments, and this is the report. So periapical lesion on 37. Okay, so periapical lesion. This is the comment. This is the report on the periapical X-ray that I did. If you don't do a periapical comment like this, okay, nothing will be shown in comments, but by default, we have to have two different level of comments for NABIDH. So this is why when you double click, you have the comments number 1 and the comments number 2. Okay, and this is a procedure. A procedure means that it's something that you charge for that. Okay, so you've been doing that. Let me do something else. I am going to make a semeo, and I guess that there is acute periodontitis on pulpal origin. So we have an infection, and I write the infection here, and it comes here. It comes as a diagnosis. Acute periapical diagnosis. So you have diagnosis, you have a procedure, and you are going to make an invoice. We go to insurance. The patient is MedNet, so automatically we will get the form, the claim form of MedNet. And here you have the name, the card number, the telephone number, and here you have the diagnosis. The diagnosis is coming automatically, acute periodontitis on pulpal origin, because in this claim form, they ask for diagnosis and they ask for what we've been doing. Okay, and at the end, we've been adding, if you want, we've been adding this, and the invoice number is not coming at this level, but when you will save, automatically, it will give an invoice number. So this is the new generation of what you have now. And of course, once again, we can download PDF, we can print, we can post, means that everything is invoiced. So this is an invoice, we invoice, and we have all the details of the treatment, and we can print all this, and this is print or sent by email to the patient. Whatever you do, you can always send or print. Okay, I go back and I go here. Voila. So I am going to give you now an example of prescription. So prescription is linked to NABIDH. And here again, it will change your way to work. So I am not allowed to do this. A pre-filled, so vitamin C, Birodogil, Advil, I am not allowed to do this for NABIDH. I make this as an example, but this is not allowed. You cannot put pre-filled invoices because you do the same all the time. So it is not working in a good way for them, and they will refuse that. So we don't do that. We do not do pre-filled prescription. We have to fill the prescription. So how do we do? Prescription, template, we take a blank one, okay? On the blank, I am going now to go here, and I am to say, I am using antibiotics, let's say augmentin, I am using antihistaminic, and I am using antalgic, okay? And this is coming here, okay? So my prescription is done, and I am going to save in history and print. If I want to print to give to the patient, I give to the patient, and we are not linked to a pharmacy. So they will go wherever they want. They are not linked to a pharmacy. That's important also. So this is the history. And for example, I want to send by email to the patient a document. I will send the document, and the prescription is coming here. I will send the prescription. I want to send in CC to someone. I can type Emira, for example, Emira, and I have Emira is coming here, and Emira will receive this email attached to the same the email of the patient. It can be your assistant, for example, or whoever you want. Okay, so you can attach a document which is linked in the patient's file, and it is in the history. So I go to history. Okay, I had a claim form. So the claim form is coming here, and you have the amount of the claim form. So you know what kind of claim form it is. You see this patient, we open and we discharge the patient. So this is the discharge. This is mandatory to keep for NABIDH. You see, these are new documents that you don't have to do it in a normal way, but now you need to do it, and you need to have the track. Okay, let's see the prescription. I have a prescription here. Okay, another kind of prescription. So I have the prescription, and I want to modify. This is mandatory for NABIDH. I could not do it. What I could do by the past is I could remove or edit a new one. No. Now, because of NABIDH, on prescription, you can delete the prescription, or you can modify the prescription. So you click here, and we have been adding that so that we can remove, let's say, Flagyl. We don't need Flagyl. We remove Flagyl. We keep only Ampiclox, Panadol, and Listerine. We've been changing that. We save it in history, and we print or we send by email. So this is a new tool that you have, the way to modify the prescription that you've been doing before. So this is doing that. Once again, NABIDH is changing the way you work. Okay, I think this is what I wanted to send you, SMS, you can send SMS, email, WhatsApp, images. I go to images. So NABID is excluded. There is no image with NABID. Okay, it's not working, and we cannot send an X-ray. We can send the report of the X-ray to NABID, but not the X-ray. We cannot send the CT scan, but we can send the report of the CT scan. Okay, so this is the Emirates ID that we keep in the patient's file, and this Emirates ID allow us to fill the forms. Image, so we have several clinical images. So what you can do also, you can edit the image. If you take an image into a mirror, you can make a flip horizontal, and you have the image on the other side. Flip horizontal, it comes again on this side. You can rotate the image, you can crop the image, you can do all what you want. No need to go outside. No need to use several programs. All the programs are in AccuDent. So now, about insurance, in many cases, we have a lot of documents from insurance. They're asking for this, asking for that. You store the insurance documents here. If you have movies, you can store movies. OPGs, the last OPG will be edited on the patient's chart. Others, it's up to you. Scanner, okay, scanner, you have two levels. The first level of storing a scanner is to store it as a DICOM, but this is very heavy. And we have a program which is called .axis. It will bring all your documents from a DICOM document to a .axis document. And instead of waiting for 15 minutes to load, in less than 1 minute, you will be able to load your CT scan, and you will not have to pay to load all these things. The other option is to keep your scanners on your computer, on your server, if you want. So X-rays are here, and I'm going to show you again what we can do when we are sending emails. So when we are sending emails, I send an email. Okay, I send a document, let's say. Here I have my document. So if I want to send a picture or an X-ray, I click on X-ray and I put the X-ray, and the X-ray is sent by default in my email. So there is nothing to search, nothing to spend. Okay, everything is very easy to manipulate. You can do all these things in a very, very easy way. Let me go. I close all this and I come to this. Voila, this is most of the important thing we have in forms. We have a lot of forms in signed document. Okay, let me go back to signed document. So because of DHA today, it is mandatory, you have no choice to fill the informed consent with anesthesia, clear aligners, cosmetic dentistry, endodontics, extraction, bone graft composite, scaling, everything you do, you need to sign that. So what we do, we've been doing some online documents. So these are coming from DHA. You can change if you want. I mean, it's up to you. It's you who are involved in that. And we use a tablet. And when the patient is installed, we just ask him to sign. So we go to digital signature. We have the document and the patient signs. If we have the signature of the patient in memory, we can keep it. If not, we ask for new one. The patient is going to ask for this. We save the signed signature. And the witness can be someone working in the clinic. We'll do here another signature, because we need two signatures for DHA. So once again, not only it's mandatory to have an informed consent in English and in Arabic, but also we need to have the signature of the patient and the signature of the witness and the signature of the practitioner. So what we do most of the time in our clinic, we save and we send to the patient by email. We don't want to print all the time. We stop printing. So now we save and we send to the patient by email, or we save in the history, and it is in the history of the patient. So I am going to show you that in the history. Here is the history. I click on history and I have all my documents. And if I reload, I will have the last one that I've been done just now. So now let's go to the chart. Sign scan ID, so you know scan ID. What you can do also, you can click on video, and clicking on video, you click, you make a emergency, for example. The patient has pain, the patient is at home, and is going to he just sent you a message that he has a big cheek and he needs to see you, and it's on Friday, he cannot see you. So you can get access wherever you are on this program, and you can create a meeting, and the patient will receive by SMS this series of information to start the meeting. And when the patient will click on start the meeting, automatically it will come to you. Nothing to load, nothing to prepare in advance. And we are using a separate agreement with Zoom. So it's not included in the program because DHA refused to accept the fact that we are making video conference with an internal system. So for this reason, we are using an external system. So patients arrive, you know what it is? Stickers. So we have a certain number of fields like this where you can write things. Okay, you can write a lot of things. There is no limit. Okay. And you can have another one here. This is more for internal, okay? So if you don't want the patient to see what is written there, let's say you have been writing, the patient does not pay well or something like this. So in this case, you can hide it. In this case, you can hide it, okay? So you show to your patient whatever you want to show. And this is linked to, you know, the dental chair where you have on top, you have a screen and with everything, the patient can see everything. You can show or hide these things. A sticker is something that you can go here. You can edit a sticker, call patient. A sticker is something fast. Call patient in emergency. And I'm going to register. I can do it like a voice. Call patients in emergency, and I save. Shall I fix that? So we have now a sticker which is coming. The sticker is coming at this level, and at this level, I can move it all around. I can put it here. I can put it down so it's hidden. I can also hide it. This is a kind of sticker like you use the Post-it, you know. You can hide also. So everything can be done in a secure way so nobody can see that. Or you can show it. Or you can go here and you can delete it. Or I am going to show you something else because I didn't show that to you. Okay, call the patient immediately. I save, and I show you. Okay, I don't know why it is not coming. It will come, but you can have the recorded message if you want. Show here and delete. Maybe I deleted. I'm going to try to do it again for you. Call the patient immediately. Okay, call the patient. Okay, never mind. Stickers, lab orders. So we can link also because we have been automatized the lab orders already. So if I click on the lab orders, I work with different laboratories. And this is another program which is called eMedical Manager. But since long time now, we just send orders online using eMedical Manager, and we have a tracking. It is mandatory to have a tracking of all our links. Today, we cannot do dentistry without tracking all. This is the reason why everything is tracked, okay? And we have also not only the lab orders, but the access guide, which is the orders for the lab, for the surgical guides. So all this is on the way. So now we can go to payments. So once again, payment will not be linked to NABID, but you have a payment. If I click, the amount is 0. If I click here, the amount will be this one. And paid in cash for the invoice. Do we have been editing an invoice? Yes, this is the invoice. Now the search will not be by patient, by invoice. I save, and I have a payment done to Anna Joseph, by Anna Joseph, to this Arshad patient. If I go to report, I go to income, and I need a password, and doing my password, I see the invoice of the patient pays today. So I can have day per day. So this is today. I can have all, I can have by per month. I can have all what we want. In the patient, we have the patient paid that, the insurance name. If we are in a network with any insurance, the insurance will pay that, and it will come here. And doing that, we have the full turnover. So what we can have also is the income report. So the income report is only accessible to the owner of the clinic. It is showing his report, but also the report of Ursula, who is another dentist working in the clinic. So we have the income reports also, and these income reports are following all the payments done during 12 months. And doing that, you have the curve of that, and we are going to add more chart. Voila, and you have also the pending payments. The pending payments is important to know. Once again, you have a password to enter. So you have all these pending payment, and in a pending payment, you can see the unpaid by RIMA. If I click, I go to RIMA, and I try to understand why it has not been paid, and I can go back to the patient. I can send a form for a reminder for payment, and I'm going to show you how we find a reminder. Okay, we have a reminder. I don't know where, but we have a reminder. By email, we send a reminder, and we have different levels of reminders. Okay, so now we have something linked to NABID, mandatory and linked to NABID. It is this. They call that problems. We have been calling that medical, but they call that problems. NABID, it will come into problems when you get access to NABID. Let's say the patient has cholesterol, so we say yes, okay, and the problem is today, and problem lifestyle, it's active, and common, it's mild, okay? So this will come, you have diabetes, you have heart pathology, you have all these asthma, overweight, and all, and we save that. When we save that, and we go to the patient's file, we are in chart now, you will see that cholesterol mild is coming here. So by default, automatically, when you have a problem, the problem will come and it will move on a banner on your patient's chart. Very easy, no need to go somewhere to have the information. So after the medical, which is mandatory, you cannot remove that. You have to do it. The chief complaint. So this is the chief complaint that we need to send to NABID once again, but this is really related to the dental state. And the dental state like this is something that you have everything covered by this questionnaire, okay? The gum, the hygiene, the missing teeth, the aesthetics, the cavities, discomfort, all that, okay? Discomfort using dental teeth, yes. Okay, we put yes on the, during dental treatment, yes. Scared, okay, patient is scared, okay? So we save, And once again, when we go to the patient's file, we go to the patient's file. On the patient's file, we will get, I re-edit that, and you will see that your patient is scared and it will come automatically on the patient's file. Okay, I am on another file. Okay, let's go now to another level. It is the vitals and allergy, and this is mandatory. The questionnaire here is mandatory by NABID, and we need to fill that to send to NABID. So it doesn't mean that you have to take the body pressure of your patients. It doesn't mean that you have to do it, but if you do it, then you will write it here and it will be sent to NABID. And you cannot make the blood pressure in one number / another number. You need to have a blood pressure diastolic here and the systolic here. This is NABID compliance. We have to do it this way. We cannot change that. And after NABID, they have been adding a certain number of allergy. I have been adding this drug allergy. Yes, for example, and this is minor, and this is penicillin, for example. Okay, so I'm going to save this. And of course, when you edit such a questionnaire and you want the patient to sign it, you go down here and you can have a digital signature, which is like this. You ask the patient to sign signature, save the signature, and you save the vitals and all that. And you save in history. No need to save in the and print. We don't want to print anymore, but we need to have a tracking of everything. Voila. So you have the vitals and allergy. You know what it is now. Let me reload because we have been saving things. And I am going to show you the last thing. The last thing I am going to show you is the NABID link. Okay, so today NABID in NABID was not working. They were on repair, so maybe I cannot show you. Maybe I can show you. I am going to open my file to make it possible. Alors. Okay. Now I go to my file because I am linked to NABID, and this is not my file. Voila. I am in my file, and you see, if you are linked to NABID, you will see this. This logo means that you can go to NABID. If you don't have that, you are not linked to NABID. It's very clear. You need to have a point of access. So this is the point of access. You go to DHA NABID, log in. I am not sure it will work because they were on making repair. It seems to work now. So last name, I put the name of one of my patients. You will forget the name. I put the name, Lorraine. Voila. I don't know if it's Lorraine or Lorraine. Okay. And I search Lorraine Soulier. Oh, here it is. So this is your access. Now you are inside NABID. I click on that and I have the details of the patient. So we've been seeing her for acute gingivitis, chronic periodontitis, and specified acute gingivitis. There is no allergy, no medication, no previous study. This will come with the diagnosis, x-rays and all. Discharge, I saw her 3 times, okay? And I have no information coming from other dentists, okay? But in the future, she will go to different dental clinics, and we will have all the history of what's coming here. You have all conditions, allergy, medication, documents. What's interesting is procedures. So we go to procedure and we know the history. The provider is Philippe Tardieu. I am linked to this patient. But if someone sees this patient, it will be added to here with the name of the practitioner, the date and the procedure. So she had 3 procedures. She had 2 prophylaxes and 1. Okay, I would like to end now. So you've been able to see what is NABIDH. You've been able to see in which area we come. And I will strongly tell you to start early because it takes a lot of time to implement everything. And you will be late one day or another. And then DHA is coming, GSK is going to give funds.